Can you tell this honorable court your name?
I'm Dr. Solaja Taiwo.
What do you do?
I am a consultant anatomic pathologist.
Your address?
Department of Morbid Anatomy, Lautech Teaching Hospital, Oshogo.
I'm writing this.
Consultant anatomic pathologist. Anatomic pathologist.
Do you know your address?
Yes, of Department of Morbid Anatomy, Lautech Teaching Hospital, Oshogo.
Do you know Senator Isiaka Adeleke?
He is a well-known figure.
In what capacity do you?
As a serving senator in the country and as the former governor of the Washington State.
Cast your mind back to the 23rd day of April 2017. Can you recollect what happened?
Yes. On the 23rd April 2017, in the morning, I was a Sunday. I was in church. I was called by the Chief Medical Director of Lautech Teaching Hospital, Professor Painkillers-Dr, who informed me of the demise of the senator.
Yes.
And that they need to have an autopsy so that they can bury the body that same day. They implored me to come as quickly as possible. So I got one of our resident doctors, Dr. Makinde, to come with me to assist me. So we left Ife together. On our way to Oshogo, when we got to Akoda Junction, we were met by a pack of angry youths. These youths blocked the highway in front of Akoda Junction. They were burning tires on the road. There were a lot of traffic congestion. People were running helter-skelter, and everything was very rowdy.
Alright.
So I stopped and I called the CMD to say that there is a problem, that some angry youths were blocking the way and harassing people, and we were actually arrested. They bashed my car with big sticks, and we were actually afraid for our life. And we had to turn back and seek refuge somewhere near the road, off the road.
Around what time did all this happen?
That was around 2 p.m. in the afternoon. I called the CMD and I told him, and he asked me to wait for him nearby, that he would do something about it.
Yes.
Shortly thereafter, he arrived at the scene and asked me to follow him in our own vehicle. So,
in whose vehicle?
I and Dr. Makinde were in our own vehicle, so we used our own car to go and follow his own vehicle. So he then talked with there are some policemen on the road there, including that riot of that policemen. He talked with them and part of the youths.
Yes.
After consulting with them, we were allowed to pass, led by those youths. So we came down to the hospital and he called me while we were driving that, oh, the people are waiting for us at the morgue, that we should make haste. When we got to the morgue, we saw family of the deceased with a lot of crowd in front of the morgue.
Do you by any means know the name of any of the relatives?
Well, the woman was identified to me as Mrs. Adeleke, as the sister to the deceased. Then the police, the superintendent who come in, the DPO of the police station, gave him coroner. Superintendent who come in, gave the DPO of the police station, served with the coroner papers from B&C in respect of autopsy for the late senator.
Coroner paper from
B&C, from B&C.
In respect,
of autopsy for the late senator. He also gave us history, as normally we do in these kind of cases.
Who gave you history?
He gave us part of the history.
let's talk about the corona papers, the corona form. The corona form C, B and C.
Yes.
Are they with you?
Yes, sir. Yes.
Where are they?
They should be in, I think they should be in my file.
You want to keep coming then? Because you must present them to me.
I wasn't aware of that.
You did not advise her.
I did.
You did not advise him.
I did, sir.
We're talking about history.
Yes.
Who gave you
Who gave you
history?
history?
The family produced a man whose name was not given to me. He was tall, light complexion, and was the company of the relatives.
Which?
The family produced a man
Yes, sir.
to me.
Which of the families produced the book?
The family of the late senator.
Do you know the name of the
Except for Mrs. Taiwo Solaja and her husband, who are there. I didn't know very well.
Were they one of the people that produced the book?
Yes.
Okay, go on.
Produced a man whose name they did not mention.
No, sir.
Yes.
Who gave us the history of what happened prior to the death of the senator?
What was the history?
Waiting. You said he gave us the history. Who are the us? Who are the us?
And the team, I and the resident doctors that were there at the autopsy.
And the resident doctors?
Yes, sir.
How many of them?
2 resident doctors.
What are their names?
Dr. Adeleke and
Yes.
Dr. Abidemi Makinde.
He gave me and the resident doctor the history. I did. Yes. No other person there at that time. When he was giving history.
The DPO was also in attendance.
Who else?
The sister of the deceased and her husband and some other members of the family that were not introduced to me.
What of the same?
Yes, sir. Yes, sir. The same was also in attendance too.
So what was the history that was given?
The issue was that the deceased complained of pain and inability to sleep, and hence
I'm writing this. Pain of
inability to sleep and
pain
in the knees
in the knees.
and inability to sleep. So we were said to have been given some drugs. But these drugs were given intravenously alongside 500 ml of intravenous fluid.
Did you ask the name of the person that gave the drugs?
No, I was not told. I did not ask.
These drugs were
40 milligram of diazepam. 200.
what other name do you have for that?
It goes by various trade names.
Like
Also
Sadium?
called Valium, yes.
Okay, I want to be sure. You know I'm a layman.
It was also given 200 milligrams of hydrocortisone.
Yes.
1,000 milligram of analgesic.
1,000 milligram of analgesic. Yes.
1,560 milligram of gentamicin. And 30 milligram of pentazocine.
30 milligram
Pentazocine.
pentazocine.
Zocine.
Yeah. Is that all?
Those are the drugs.
Okay.
And sedation was said to be immediate. However, it was noticed shortly thereafter not to be breathing again.
Did you see these drugs or injections?
The police brought the empty vials and ampoules of these drugs. So he was rushed immediately to a private hospital within Oshogo, where he was confirmed dead.
You don't know the name of the hospital?
I was told it was Biket Hospital. And from then, he was referred back to us for autopsy.
Are you aware of the dosage of these drugs or injections that were given?
He has told us.
Are they normal dosage? Are they giving a normal dosage for all those people?
No, they appear to be on the high side, abnormally high side.
When these drugs are given in high dosage, can you tell me what the effects?
Normally, when drugs are given above the therapeutic dose recommended dose by the doctor, the patient is likely to suffer a lot of unpleasant side effects, some of which include things like they may feel dizzy.
Don't talk about when drugs are given generally.
These
When
drugs,
these drugs are
these
given
drugs.
in excess dosage,
Yes,
what happens?
they can cause, like the diazepam, can cause depression of the central nervous system.
Wait, oh, that English is much. I have to. Diazepam can cause
Depression of the central nervous system,
depression.
can cause drowsiness,
Drowsiness.
can also cause respiratory depression too.
Depression.
Respiratory depression. It can also cause nausea and vomiting.
Yes.
The same goes for pentazocine. Then for the analgin, it can also cause the same thing. Not only that, it can also cause cardiovascular collapse.
Analgin can have the same
Effect in addition to the
same effect in addition.
with cardiovascular collapse.
And what can cardiovascular
The patient
collapse
will faint.
cause? Okay.
And the autopsy, we found the body of the late senator on the slab. We examined the body.
Were you the only one at the autopsy?
No. I had two resident doctors with me. The chief medical director of the hospital was in attendance. The DPO, who was the IPO for the case at that time, was also there.
I was with my two residents,
Yes, sir.
Dr. Adeleke
Makinde,
and
Dr. Adeleke Ajayi.
the DPO do that.
Yes, was in attendance. He was in attendance.
Yes. The CMD.
He said he was also in attendance.
Who else?
Then Professor Adewale of chemical pathology.
OCO side was not there.
He was not inside with us, inside the autopsy room.
Okay. Professor
Adewale of chemical pathology. Dr. Teaching Hospital Oshogo. Then we have two mortuary attendants, Mr. Agbeshi Olalekan,
two mortuary
attendants.
Mr.
Agbeshi Olalekan,
and
Mr. Adigboye Municipal. So at autopsy, when we examine the body,
you look at me, don't look at that place.
we see the body, saw the body of a well-built man.
Okay.
He was clean shaved.
We saw the body of clean shaved.
Yes, clean shaven middle-aged man.
Yes.
He had an odor of alcohol about him.
He had
An odor of alcohol about him.
about him.
Yes, he was. You can perceive the smell of alcohol on him.
Yes.
His tongue, the lips, as well as the finger and toenails had this bluish discoloration.
Okay. The tongues, lips,
Lips, the nails, both
fingernails.
and the toenails. He was not jaundiced. Neither was he pale.
Yes.
And the limbs appear symmetrical, both upper and lower limbs.
The limbs.
Yes, sir.
Appeared symmetrical.
Yes, sir.
Can you explain that?
That is, you are normal.
Okay. Why won't you use?
Because
Use English, don't use medicine.
there were not any area of discoloration on the skin of the lower limbs.
No discoloration.
On the skin of the lower limbs. Neither was there any swelling in the limbs.
Yes.
He had no pedal edema.
He had
No
no
pedal edema, that is,
odema.
yes, I want to put that.
Odema.
Can you spell that?
Okay, O-E-D-E-M-A.
He had no
Pedal, that is in the foot.
pedal.
Yeah.
Okay. Yes.
All the limb joints, including the finger and toe joints, appeared normal.
Yes.
He, however, showed a mild degree of finger clubbing.
He, however,
Showed a mild degree.
finger
Clubbing.
clubbing. All right. Which means
That means the terminal ends of the fingers appear slightly swollen. There were no palpably enlarged. There were no palpably enlarged superficial lymph nodes, and there were no external injuries on the body. So, after the physical examination, we made incision so that we can get access to the organs inside the body for proper examination.
yes.
I don't understand, I can just go to the main findings.
You made
I think-
incision.
Yes, sir.
Yes.
Okay. The cavities in the body were normal.
That's the findings.
I'm explaining the findings. Should I go to the main findings?
No, we have all your time. Explain everything you feel you want to tell us. Are those things not necessary? These ones you want to say.
Yeah.
Explain everything you feel is necessary for you to tell us. Because even if you don't tell me, I will ask you. And there are people here that will ask you. So,
All the body cavities, that is, were free of excess fluid and were normal. In the respiratory system, there was no pneumothorax.
the respiratory system,
There was no pneumothorax.
there was no what?
Pneumo.
Sorry.
P-N-E-M-O. Thorax.
Yes.
The pharynx was free of foreign body.
The
Pharynx, that's the throat.
yes.
However, the mucosa of the upper part of the airway, that is the trachea.
However, the trachea.
Yes. The lining of the trachea.
Yes.
Okay, was hyperemic. I mean, it was reddish, as if there was bleeding there, as if. And we're able to see.
As if there was bleeding.
Yeah, I'm trying to explain hyperemic to you.
I've gotten it.
Okay. Okay, and it contained traces of gastric contents.
What's gastric content?
That is what is in the stomach. The lower part of this airway, that is the trachea, down to the bifurcation, to the bronchi, and the smaller airways.
You better take it easy. The lower part of the trachea.
Yes.
That
the
is.
bronchi. No, not that is.
Okay.
The lower part of the trachea. The lower part of the trachea. The bronchi.
The bronchi. Yes.
And the smaller airways. Were filled with gastric contents. The lungs were atelectatic. That is, they don't
The lungs
collapse.
were, I want your English too. The lungs were
Atelectatic.
Can you spell?
A-T-E-L-E-C-C-A-T-I-C.
atelectatic. Right?
Yes, sir.
Okay.
They were flabby and dull in appearance.
They were.
The right and left lungs were weighed. The right measured or weighed 500 grams. And the left 450 grams. This is the main ornament.
Okay.
The lungs were firm to touch.
These are within
Yeah, I
normal.
think they are not like they're just normal.
Okay.
And they were firm to touch. Cut surface was mahogany in color.
Mahogany.
Yes, sir. But just otherwise, nothing else was found there. We looked at the heart. It was enlarged.
It was enlarged.
Yes, sir.
Do you even have any feelings for human body? You are still human.
Yes, sir.
We look at the hearts. Go
Yes,
on,
sir.
please.
It was enlarged.
And you were cutting.
My pushing at it, sir.
Okay. We looked at the hearts.
It was enlarged. Weight 600 grams. Which is almost times 2 of what is expected for that age and sex.
It's almost double of the normal.
Yes, double.
Yes.
There were no areas of rupture or discoloration on its surface. The pulmonary trunk was free of blood clots, and there were atheromatous plaques.
There were.
Atheromatous plaques.
Is it that atheromatic that you didn't?
No,
You haven't
sir.
told me that.
No, this is the first time I'm using the word to use. Atheromatous.
Atheromatous plaques. That's the way I would call it. Yes.
Yes, sir. And the vessels that supply the heart.
In the
Vessels
yes.
that supply the heart.
Yes.
And these plaques have less than 30% maximal luminal occlusion.
They had.
Less than 30%. In other words, these plaques were not actually totally blocking the vessels. They were just there and they were a bit small.
He had less than
30% maximum luminal portion.
maximal.
Luminal portion. Luminal.
Okay, luminal
Occlusion.
occlusion.
Occlusion. Blockage.
Okay. Okay. Meaning
That these vessels were patent, even though there is a layer of some automatous plaques within the vessel, but the vessel was still patent.
was still patent.
Yes, sir.
That means they were still free.
Yes, you want to put it that way.
I will use your language. Okay.
The heart chambers were free of blood clots.
The heart chamber.
Yes, the chambers of the heart. And the valve measurements, you have valve lengths there. They were within normal limits.
The valve. Yes.
However, the free wall of the ventricle, left ventricle, appeared thickened.
The
Free wall, that's 2.5 cm, which is more than is expected. It is known that excessive alcohol intake, because we're able to perceive alcohol on the body, so we assumed it must have taken place. I said we will perceive alcohol on the body earlier on, so we assume he has taken alcohol. And it is known that excessive alcohol intake may also depress the central nervous system with attendant blunting of the gag reflex. In addition, the disease was deeply sedated, as was mentioned in the history earlier on.
it was
Deeply sedated. And had overdose of analgesics.
the toxicology also showed
Abnormally high levels of alcohol, sedatives, and analgesics
yes
in the blood of the deceased. There are no poison or traces of heavy metals seen in the toxicology report.
no traces of
Poison
poison
or heavy metals.
or heavy metals.
Yes, sir.
No traces of poison or heavy
Metals
metals
in the toxicology.
in the toxicology.
There were also,
Dr. Solaja, who did the toxicology?
we gave the samples to the police. The Nigerian police then did the toxicology and gave us the results, which they took back.
They gave you the results.
Yes, they brought the results to me on 15th of May.
Yes.
I went through the results and they took it back with them.
Aren't you supposed to have a file copy?
Yes, I told them to bring a photocopy for me, but they did not come with one.
Can you tell the court the name of the person you gave the samples?
Yes, it was taken by this CSP Benedict Agbo, who I believe was a police toxicologist. The result of toxicology, the actual printout was with the police. They did not give me a copy of such of the results. But I was able to go through it and make my impressions.
Okay, you went through.
Yes, sir.
Let me take that. I went through. Are you qualified to draw conclusion from what the toxicologist has done?
As the lead investigator in the autopsy,
Yeah. You have the right to.
yes, sir.
Okay.
Can you tell us?
Let me take that. As a lead investigator, he has told you, he said there was no trace of poison and no heavy metals
Is there any
And
other
I confirmed abnormally high levels.
of alcohol.
Alcohol,
Yes. And
sedatives, and analgesics.
analgesics. Yes, we have that.
Is there any other thing you want to tell me? Is there any other thing you would like to tell the court?
Your autopsy report, are you here with it?
Yes, sir.
Please lead him to tender day.
Where do you have?
Who signed it?
Who signed? Who signed the report?
I signed the report.
All right.
Can you tell us?
Look at
Did you bring us the original or the?
It's not a photocopy. It's a copy, a file copy.
Okay.
The original copy has been given to the police over the case.
So, respect the Lord, I've seen the copy that I've got. It's not really a case of original. What they have is, I think the documents are producing counterpart. For which of them, all original. All original. Yes, thank you. So, counterpart is the appropriate word.
Thank you.
So you produced many copies?
No, sir. That is the file copy that the police will sign on that they are receiving the other copy.
The other copy?
Yes,
You
sir.
cannot call that original. They are all counterparts. That's why you are not learning.
But they are produced by the same process.
You are highly educated.
So Lord, we send that the counterpart copy.
Okay.
You now look at the original copy, the same process.
You would like to inform, you would like the court to know, is there any other thing that maybe we are not asked to that you like the court to know?
I made the diagnosis, my impression of cause of death to be aspiration associated with multiple drug overdose.
That will be all for me. Okay, from your side.
From my side.
All right. Let's now throw it to the people at the back. Do we have questions from him? For Dr. Solaja, MD, let me see the qualifications. Maybe the papers, maybe you can explain them to us. What is MPC,
MD, CHP, that's Bachelor of Medicine and Bachelor of Physiology, which means the first.
and the other is Fellow West African.
College of Physicians, where laboratory medicine falls under.
It's okay. You are highly qualified to give us this.
That's the copy.
Yes, questions please. Do we have? Okay.
Did you find secretion?
Secretions?
Yes. The respiratory tract of the disease.
It was clear, latent, apart from traces of gastric content that was seen in the earlier part, and then the lower part was actually filled with this gastric content.
And there was no secretion in where?
The respiratory tract.
All right.
Are you aware that Anagin had been banned in Nigeria since 2006?
Yes, I'm aware of that.
They found sizable traces of that Anagin as part of what was injected.
The toxicology reports found high amount of allergen in the blood.
Aside the toxicology reports, when you are taking history, you are also informed by the one introduced to you by the family of the deceased that Anagin was part of what was injected. I'm not talking about
Yes.
Will you confirm that?
Yes.
That's part of the issue given to you by the person who spoke on behalf of the family was that anagin was one of the substances
Yes.
that was injected.
Yes.
And you saw the ampoules of vial of those anagin.
Yes, they brought the empty vials and ampoules of the drugs. It was presumed to have taken.
You saw them, that's what I'm asking. You saw them
Yes.
empty vials. As a consultant, is it possible in your opinion for death due to aspiration of gastric content, which you said is the cause of death, to have been caused by poisoning? Is it possible? I'm just asking opinion evidence.
Well, I think maybe you should explain what you mean by.
You see, in this instance, your finding is that the death was caused by aspiration associated with multiple drug overdose. You said that death was caused by aspiration associated with multiple drug overdose,
Yes.
and the aspiration was manifested in terms of alcohol, sedatives, and anesthetic in the blood, taken from your report.
The way I wouldn't put it the way you're putting it.
How will you put it?
He had, from the toxicology, high level of alcohol in the blood, high level of methanisol, which is the energy we're talking about, high level of methanisine, high level of diazepam. These drugs can induce vomiting. These drugs, not only that, can also cause blunting of the gag reflex. The gag reflex is what stops you from aspirating if you are accidentally you are eating and something wants to pass through the airway. The gag reflex blocks that. These drugs blunt that gag reflex, lets down that defense. So it becomes easy for somebody to easily aspirate, especially if you are overdosed with these drugs.
I want to ask you frontally, why would you rule out poisoning as the cause of death? Why would you do so?
From the toxicology report, they didn't find evidence of poisoning.
I rule out poisoning as the cause of death because
Of the toxicology report.
By which poison was not found in the body of the deceased.
Exactly.
Thank you for that. I would perform respect. I would want to take the money, not out of disrespect to your worship, but have an engagement outside.
we appreciate your presence. Thank you very much. And Dr. Solaja, my forms B and C.
Yes, sir.
You want to ask a question?
Yes, sir.
Okay, please come forward.